important, especially for future physicians, which I know a lot of people in this program are, to have sort of the population-based background in medicine more than just a patient-centered approach. So I think it's important to understand, both practices and how they work together. So I think it would be nothing but good to have this sort of experience, to be able to think on a population level and then apply it to a patient, or vice versa. If I see a patient who may be at the beginning of an outbreak, it's important that I can recognize that.
Oh, public health is very global, and the courses here show that. Almost every course I had would talk about other countries. They have a whole course just on global public health.
Doing my practicum and everything, that's giving me a lot of really practical experience. So I have high hopes for my job and everything in the future. So I think it's really going to help me. I mean, public health is a growing field, so I definitely think this program has helped me to find a job, because when I first graduated with my undergrad, I mean, the economy was, there was no chance of me finding a job really. So I think this has helped a lot.
And epidemiology is my passion. So that's what I do. Actually, the other 4 days a week I work for the State Health Department, and I've had a lot of training in epidemiology and use it every day there. So it's very exciting for me to be able to teach that to students and use a lot of real life examples. So that's fun.
Some of the advantages to the Michigan State University Public Health program are the online courses, which offers flexibility if you are already in your career, or if you have outside obligations. The electives are fantastic. The number of specializations that you can do were great. I mean, I was introduced to a field that I had never even thought of before, which was counterfeit pharmaceuticals. And I took 2 electives in that. And the opportunities abroad in this program are great. And the administration for the public health program has been very supportive to me throughout my 2 years.
If we look at the longevity of people in the United States, how long people live, you find that there has been an increase of about 30 years over the last 100 years, okay? People, lifespan. The great majority of that, all but maybe a handful of years, is due to public health. And most of that, and this is me making a pitch for environmental public health, but most of that is due to changes in the environment. Living conditions, water quality, air quality. So I'd say welcome to environmental public health. It's been important in the health history of this country, and it will continue to be important for a long time.